Welcome to CEO Intronet. I'm your host, Patty Owens. The government has authorized $19 billion, that's billion with a B, to improve healthcare outcomes and find ways to gain efficiencies in this critical sector of our economy. We have the benefit of listening to three healthcare executives who will help us understand how that money should best be spent and what the future of healthcare will look like. Let's meet our members.
I'm Peter McGrath, CEO of Coriendo, and we're based in Bala Cynwyd, Pennsylvania.
Shawn Archambault from FluidEdge Consulting. We're in Wayne, Pennsylvania.
I'm Tim Kowalski, President and Chief Executive Officer of Halfpenny Technologies, and we're located in Bluebell, Pennsylvania.
So welcome to all three of you. It's great to have three experts in the healthcare space who have apparently all gotten the memo to wear the same shirt with yellow tie. But despite that similarity, I know you have very different opinions on what healthcare is going to look like going forward. Let's start with the present. So here we are in the midst of a tremendous crisis in healthcare that is finally now being addressed. But what's that $19 billion going to mean for healthcare, and how do we best leverage it for productive change? Peter, let's start with you. What do you think?
Well, before the $19 billion, there was banks and banks of paper files, and to get that information out of those paper files was a very difficult thing. The whole hope of the $19 billion being spent wisely is to provide researchers, doctors, patients with better care and more information. And we're on our way there, but it's a long, long journey.
I see you nodding, Shawn. What about what Peter said is true?
Going through my head are the number of initiatives that healthcare organizations need to take on over the next year and a half, 2 years, 3 years, including ICD-10 transformation, electronic health records, meaningful use, accountable care organizations, health information exchanges, health insurance exchanges, all things that are part of the mandate and part of what the government is asking the healthcare industry to take on. And it's pretty daunting, but if it all comes together, ultimately it should help the entire healthcare industry.
So daunting sounds like a good word to me, because really you're asking to boil the ocean in some ways and restructure an already large infrastructure that exists. This is a legacy business that you're asking to turn in a rapid way. So Tim, what are your thoughts on how likely it is that we're going to make significant progress in healthcare over the next 10 years?
Well, that really is a challenge over what period of time. So healthcare historically has been a slow evolving industry. We've seen other industries. Peter talked a little bit in some prior discussions about the financial services industry and how that's evolved. Healthcare, the government is really trying to motivate the healthcare industry to change, and at the heart of that is really to improve patient care, which is what everybody cares about. Will there be significant change in 10 years? I would say there will be. Exactly how it will play out, well, there's a lot of really smart people trying to figure that out in the hospitals, in the physician world, and in the health plan world, and beyond that. And that's where companies like ourselves feel that we can really make a difference in some of our solutions.
All right, so let's talk about those solutions. Where is there consensus that solutions need to be developed, and what is each of your companies doing to address those solutions?
Well, I would say that the ability to have systems talk to each other so that the patient information can flow from the hospital to the primary care physician and back and forth is a very important element in taking the $19 billion, which has been invested in the basic records, and having them be able to be shared.
And our company has been focused on helping healthcare organizations, whether it be hospitals or insurance companies, figure out how to take on all of those projects and initiatives and put some order and discipline around those projects and make sure that they actually go into place, that they're successful, and then in the end they achieve what we're trying to achieve in the healthcare industry.
So you've outlined the goal then, Peter, specifically working on electronic medical records, and you're saying we've got to help organize all the stakeholder groups so that we can all row in the same direction and get something accomplished. So how optimistic are you that the stakeholder groups will fall into line, and who's going to be fighting against what appears to be an obvious direction?
Well, the fighting against is really a byproduct of people are evolving in what they're going to provide. So a health plan, it had a defined role for many years. Well, now with some of the changes, with the introduction of accountable care organizations, with the introduction of healthcare exchanges, the role of a health plan is going to change. Smart people at each of those health plans are trying to figure out how to best do that and survive as a business entity. some of the things that Peter and Shawn allude to, we'll use the term of data interoperability. At the end of the day, there's a lot of data out there in disparate systems and different companies, and if you want to improve quality of care, it comes down to how do you really make best access to that data and make smart business decisions based on that data.
So go back to the ACO, right? Because I think just the notion of the ACO will really change forever. Who decides what is valuable? So somebody different is now going to define value in healthcare than perhaps was the case 15, 20 years ago. What's that going to mean for us?
It means it's shifting of the accountability to the providers to make sure that the outcomes associated with the members and the patients are effective, and they're less costs and more effective. And that's not unlike what we've experienced in the past. So we went through this in the mid-90s with managed care organizations. It's kind of come full circle. There's a lot of different rules, a lot of different incentives around it now, so we'll see how it rolls out.
And I would add that the ACO model is going to require a whole new level of information technology to manage it, because what you have now is a hospital and doctors and labs, and they have their own systems. The ACO is going to have a system. It's going to have a clinical system. It's going to have a financial system, and they're all going to have to be coordinated by some organization of governance that's going to manage the ACO market.
And that coordination of those disparate systems and data, that's one of the biggest difference or evolution since the HMOs of the 90s, right? And the HMOs of the 90s did not have access to all that data to make that decision-making process. And if you're going to hold physicians or hospitals and physicians accountable for the risk, they really need to have access to this data so they can make the right decisions.
Yeah.
Would doctors agree with that? Doctors are, to me, a stakeholder group, and as the daughter of a doctor, I listened to dinner time diatribes about how perhaps the quality of medical care would go down if doctors were less in charge.
I have an opinion on this.
So
I think as we move forward, and as the physician population starts to, you have new physicians coming into the market, physicians that have actually grown up with technology, right? They're more apt to, take it on and embrace it and actually understand it and use it. And I think that's what you're starting to see. You're starting to see a shift. 20 years ago, there was definitely pushback on the technology, but I think they're starting to embrace it. And there's a recognition that data is very important.
Patty,
Here,
you
I see you
mentioned
jumping
rowing
in.
a few minutes ago, and I'm a rower myself, and one of the great models in my life has been being in a boat where everyone is no longer a star, you're part of a team. And I would, if I had the ability to do this, I'd take all the doctors and all the labs and all the people who have to cooperate and put them in a boat, in an 8, and let them row up and down the river and get to know each other and cooperate. And I know that that's kind of more of an analogy than it is a practical solution. But that's the kind of effort that has to be put together. The doctors and the hospitals and the insurance companies have to cooperate with each other.
Now here I thought you were going to say you were going to put them in a boat and push them out to sea. Just start fresh with a whole new sheet of paper. But who's going to be the person to put that together? Who will drive that agenda?
Well, the driving of the agenda right now, our government's trying to take a lead role in that. And that's part of the $19 billion that you alluded to. They're trying to motivate physicians, hospitals to play along and to share and to cooperate. I think at the end of the day, it's not unlike any business. Each of these parties has to understand and figure out how do they survive and profit in the new world. It is about quality of care, but for a physician, the physician wants to know how they're going to survive, how they're going to make money. The hospital wants to understand how they're going to make money. The health plan wants to understand how they're going to make money. We need to make sure, the government needs to make sure, companies like us need to make sure that at the end of the day, it's the quality of care that improves, the efficiencies come out of the system, and then all of those parties ultimately win.
And I think the word survival is important, because there's not just incentives, there's also penalties associated with these initiatives. And I think those organizations that don't move forward and adhere, they're going to suffer at some point in the future.
So at some point in the future, we will all be people who are the main users of medical care. So let's roll forward 20 years. What's going to be different for us when we're the ones in the hospital beds, being the beneficiaries of what is, I hope, an improved healthcare system? Peter, final word.
Well, I would say that what's going to happen is that there's a tremendous amount of information that's going to be available that will avoid duplication of testing, duplication of the type of care that's being provided. And there'll be a lot more wellness and the ability to worry about our diet and worry about our exercise, and that will help reduce some of the cost.
Any other perspectives on that?
I would just say efficiency and effectiveness. I think that's what you'll see 10 years from now, is that it'll be a more efficient model and it'll be more effective.
And I would just add, to me, 10, 20 years from now, it will be more geared to the end patient and interacting with that end patient from our health insurance plans will change, the way we receive quality of care will change, because it'll be very much focused on the patient. It has to become a more efficient system.
Sounds to me like we've got optimism across the board that suggests that by the time you and I need health care, we should be in pretty good shape. I want to thank our guests for joining us. I'm Patty Owens. Have a great day.